Naamoy niya nanay niya.
Okay, dali.
Hindi. Wait, ito dyan. Waiter.
Alex to, meron ako dito pero ito lang.
Tawagin ko muna si waiter.
Tawagin ko muna si waiter. Tawagin ko muna si waiter.
Hey! Nakapawala sa stairs si Kiana. Bakit nawala si waitress? Nasa middle drawer. Coffee! Hindi pa ba yung naligo?
Naligo. Makakawin ka naman yun. Ano ito?
Alam ko may mga pictures siya eh. Yan na. Wala, nagsisilis-silis.
Ito. Galitan tayo na. Dito.
Bakit?
Mataba daw si dito eh.
Yan! Mag-Roblox na muna ako. Only not A. Only a side.
Ay, Sandra. Bibili pa pala tayo itong gantong kandila, oh.
I made you co-host, Sai.
Baby,
Who else?
Planning, doctor. Just for 2 minutes, doctor.
So you make co-host whoever you think will need to be co-host. Okay?
Okay, doctor. Okay,
So
doctor.
that's a good start. I invited your second year March batch and first year September batch, so they will be watching you. Okay?
Okay, doctor. Okay, doctor.
So do good.
Thank you, doctor.
Minute. Ang daya nyo, electric fan pa yun eh.
Hello.
Hello, wait, doctor is also in this room, Puneet.
Are you ready? Are you ready for your presentation?
Yes, doctor, we have made all the arrangements. If you could please
You
make
may
me,
ask your classmates to join.
doctor, can you please make me host and Puneet also? And also one more student is joining because 3 or 4 students will be handling the playing of all the videos.
Who will I make host? All of you, Prabhav, the area, and Bakshi.
Doctor, you can make Bakshi and one more student who is having all the downloaded files. He's joining in a minute.
Bakshi, not Prabhav. Who else? Sai Sandeep,
Doctor, this guy, Siddharth, he's
Alva,
joining us.
the one
Yes.
who's joining. Okay.
Yes, doctor, this Kala Siddharth, just make him.
Okay, I've made them co-host.
Okay, doctor. Siddharth, can you try sharing one video once so that we know that it is working fine?
Can you see my screen?
Yes, it is visible, Siddharth.
Yes.
Hello, everyone. This is literally drinking smoke has been practiced for at least 2000 years. Tobacco was introduced to India in the 17th century, later became a regular practice of smoking.
Yeah, it's
Smoking in
audible.
public places was prohibited nationwide from 22nd October 2002.
Okay. Could you guys see the video and the audio also?
Yes, it's working.
Yes, it's fine.
Okay.
Okay. Puneet, can you also try once?
Yes, I'm trying this again.
Puneet, share your screen.
Hello everyone, this is Anuswari Satyasai Sandeep representing for Group 1. Smoking in India has been known since at least 2000 BC when cannabis was first smoked. Life factors such as his or her marital status, social bonding, study was done on oral health.
Puneet, that's smoking. Sorry.
Puneet, there is a total breakdown of the quality.
Okay, Puneet. Fine, Puneet. Doctor, excuse me, doc.
Yes, what's the problem?
No problem, doc. Just the last host that we'll be needing is Kiran May. She just joined. Can you make her also?
Kiran May, this one, okay.
Yes.
You may ask your other classmates to join so we could start.
Sure, doctor. Sure.
Okay, doctor. Okay. I'll send the link.
Are you ready?
Yes, doctor.
All right. Good luck to all of you.
Thank you, doctor.
Everyone, let the students join, and we will start exactly at 2:30 from Group 1.
Good afternoon, Dr. Elray.
Hi, ma'am. Good afternoon. Good afternoon, everyone.
Good afternoon, doctor.
What's your question, Praval? I don't understand. All of we need to on the video, or all the groups
Doctor,
present?
like all of we need to on the video during the presentation of all the groups,
Yeah,
only the groups who are
only the
presenting.
ones on the current video, all members should have video on.
Okay, okay, doctor. Okay,
Okay, the rest would have video off.
okay, doctor.
So during the presentation of your group, you are expected to turn on the videos, but mute, have yourself mute only during the deliberation. You will turn on the microphone during the deliberation.
Okay, make sure that your names are on your handle, so that it would be easier to identify you.
Please rename accordingly with first with your group
आज
number.
के हिसाब से भोलू भैया पे फोन कॉल नहीं हुआ
Hello. Mute yourself again. Please rename.
Guys, please mute your mics, please.
Starting with your group number, underscore, all capital, your family name, and then followed by your first name. The LO will also going to do some screenshot. Anyway, this is recorded or it's actually live, no? So we can see if you actually attended this activity. Maybe in...
I will also post an MS Forms which will count as your attendance. So make sure that you log on to that. I will post it in the chat room. All right?
I was able to watch all the 14 videos last night. And in fact, I have already prepared some
Preliminary
questions.
judging.
I
Parang
already
beauty
prepared some
contest lang
questions. Yes, and also given their preliminary scores. So the remaining scores will be during the deliberation. Some of you actually had a good presentation with impressive content, but some were actually failed to give us valuable information about your topic. So if we can able to finish all of the groups by today, I think it would be, it actually depends on the time allotted in each group, and the timekeeper will also have
Yes,
to
doctor.
notify us from time to time. Okay, we have to notify us.
Doctor, just one question I had from you before we start. Today, after the group presentations are done, then the deliberation will only be done by the next group, right? Or the professors will also be asking questions?
Okay, during the deliberation, you will be asked by the critic group. The critic group will only have 1 to 2 questions. And after the critic group, you will call on the panelists, the faculty members.
Okay, doctor. Sure.
Okay.
And for total deliberation, then should we extend time a little, or the time will still remain 5 minutes?
We try to limit the time into 5 minutes. However, if the faculty is still explaining something which is very important, then we could probably extend it a couple of minutes.
Okay, doctor. So the timekeeper will give a notification when the deliberation starts at 4 minutes. He'll tell that 1 minute is left. And
Yes.
even after that, if it extends, then it's fine. We'll take it up from there.
Yes, yes, yes.
Okay, doctor.
7 to 8 minutes are actually allotted for the presentation. And another maybe 7
Yes,
to
doctor.
8 minutes will be during the deliberation. So all in all, a group can have 15 minutes allotted for this presentation and deliberation.
Okay, in your chat box is an MS Forms. Although main attendance would be your presentation and your presence during the presentation, please fill up the MS Forms so that we could have your attendance checked. It's in your chat box. I will also post it I will also give the link to Prabhav. It's easier. I will
Before
put it
we
in your LO chat. Okay?
before we start, actually, I'd like to thank your LO. It seems that this activity is well organized,
I
and it
feel
seems
it.
also, yeah,
अरे रुक जा भाई, रुक जा रुक जा भाई, रुक जा रुक जा, मतलब इसको रोक लिया.
good job for the LO.
Yes,
Anyway, can we start now?
I understand. Okay, before we start, I understand that the coronavirus pandemic is hitting at its peak in India. And I'm sure and I know that it's difficult for you to carry on. But life continues. But rest assured that our department will give all considerations to whatever would happen. Just give us all your effort and all that. If any problem, just come to us so that we could adjust. Our department is one of the more accommodating ones. We'll just go. We just have to go through with this activity. I know some are looking for formal clothes earlier. Uniform would suffice. Thank you for the effort as early as now. I'm congratulating all of you. Okay, let's start.
Agree.
Okay, doctor.
Okay, let's start.
Uh, Bakshi, wait for a second. Bakshi, please stop sharing for a second. Yeah. So, I'd like to welcome you all on behalf of our September batch to the event that we are having today. First of all, I would like to welcome our professors, our coordinator, Dr. Audrey and Dr. Navarro, and all other faculties who will be joining today. Today's presentation will be based on the research protocol that we all have prepared from different groups from 1 to 14. And one by one, we'll be presenting our presentations. First, let me give you the basic guidelines that we'll be following today. The first thing that will be very important for today is that after the group deliberation, after the group presentation is done, your video is being played. Only then the particular group will be turning on their videos, and all the group members should turn on their videos at that time. Only the respective group whose videos is played, only that group will turn on the video. And during deliberation, your mics should be on. Other than that, everybody's mics and all students' videos will be off. I think that's clear. Second, there should be no disturbance throughout the video playing from anyone. Whosoever will create any disturbance, their group will get deductions. So please don't create any disturbance when other groups are presenting or deliberating. Other than that, one important thing is that if that your presentations should be done in the given time only. We have a timekeeper, Sandeep, our LO, will be keeping the time. Once the deliberation 4 minutes are done, he will come, he'll turn on his mic and tell you that 4 minutes are done for your deliberation. So you'll have to sort your answers in that time only. Make sure everything is in time. If it goes beyond time, then there will be deductions. Only in the case that the faculty is giving important advice or recommendations, the time will be stretched. Other than that, your group will have to comply with the time. I hope everybody is present here. We'll begin with group one. And before beginning, we'd like our coordinator to please say some words for our students.
Dr. Audrey, opening remarks.
Nauna ako, I went ahead of myself. So, congratulations. Yeah. Akala ko yun na eh. I already gave it, but I'm giving it again. So, congratulations to your batch. This is the first of its kind that we are making your research protocol a presentation like this. I think it's an endeavor that is worth repeating because it makes you more involved and it makes you more actively participants in this presentation, and it does not come from our end. Okay, I know that we have the pandemic and it's peaking at your country, but we will give you all considerations and understanding as far as your requirements would be concerned. We will kind of soften it so that it would be handled with compassion and care. Okay, as early as now, I'm sorry for my dog. Congratulations. So let us hear from the first group. Welcome to the first research protocol presentation of the international batch.
Okay, doctor. Thank you, doctor, for your remarks and your wise words. Now we will begin with first group. Puneet, please start sharing your screen.
Hello everyone, this is Anuswari Satyasai Sandeep representing for Group 1. Our title is Research about Predisposing Factors of Oral Cancer in People of age 30 to 50 years in Uttar Pradesh in India. These are the few contents which we have been including in our PPT presentation. Introduction. Cancer is the most common cause of death in adults. Oral cancer is a broad term that includes various malignant diseases that are present in oral tissue found on the lip, floor of the mouth, buccal mucosa. It can be life-threatening if not diagnosed and must be treated early. Smoking in India has been known since at least 2000 BC when cannabis was first smoked. For few tobacco products such as tupa and homa are prescribed in Ayurveda for medical purposes and have been practiced for at least 3000 years while smoking. Dhumrapana, literally drinking smoke, has been practiced for at least 2000 years. Tobacco was introduced to India in the 17th century, later became a regular practice of smoking. Smoking in public places was prohibited nationwide from 22nd October 2002. There are approximately 120 million smokers in India. According to the World Health Organization, India is home to 12% of the world's smokers. More than 1 million people die every year due to tobacco-related illness. Statement of problem. The purpose of the study was to examine how several factors which may lead to oral cancers, involving factors that may lead to addiction of tobacco or alcohol consumption, include personal life factors such as his or her marital status, social bonding, stress levels, unemployment, low income, nicotine exposing during childhood. The researchers aims to know or address three specific objectives: to identify the significant cause of addiction to tobacco, to determine the risk factor of oral cancer in 30 to 50 years of age patients, to bring awareness about oral cancer among youth who are addicted to tobacco products. Researchers want to bring awareness how tobacco addiction leads to oral cancer. Early detection is extremely important as it results in lower morbidity and mortality. The study will use questionnaire. The response given from the patients will be calculated and researchers will know exactly how oral cancers are diagnosed. Review of literature. In 2015, Dr. Vikas Foteda surveyed oral cancer knowledge, attitude, and practice on undergraduate medical students in Indira Gandhi Medical College, Shimla in India. This survey is performed to check awareness of oral cancer in undergraduate dental and medical students. In 2016, a comparative study was done on oral health knowledge, attitude, and practices among dental and medical students in Eastern India at KIIT University in Bhubaneswar by Harish Kumar, Shamsundar Behra, Sujata Ramchandra, Kailasi Das, and Ghosh Mohiddi. In 2018, Dr. Basha Chauhan, Pooja, Dr. Deepika Sharana, Dr. Pujani, Dr. Charu Agarwal, Dr. Kanika Singh conducted oral survey among nurses and paramedical staff and undergraduate students at Eric Medical College, Haryana. The study was performed to measure awareness of risk factors and clinical signs of oral cancer, to compare knowledge and awareness about oral cancer in different study groups and how awareness and knowledge help to detect it and early and prevent it. In 2019, Dr. Tarun Vyas, Dr. Parnika Uthalia, and Dr. Pradeep Bishnoi wrote an article on oral cancer etiology and diagnostic aids. Vital staining from Lugol's iodine and Tauridine blue are used together to detect early stages of cancer. Detection of oral diseases and management is complex. In our research, we are also trying to study the risk factors of oral cancer. Methodology. This is a descriptive quantitative study design where researchers seek to understand the cause and risk factors of oral cancer in Medanta Hospital, Noida, which is located in Uttar Pradesh. The study will include patients between age of 30 to 50 years and those who are already diagnosed with oral cancer within the periods of 2018 to 2020. Data collection. A research questionnaire will be distributed to collect the data through Gmail or email. The questionnaire consists of questions regarding smoking, tobacco or weed, alcohol consumption, unhygienic oral sex practices, and so on. Study population. Source and selection of subject. So our source is Medanta Multi-Specialty Hospital, Noida, which is located in Uttar Pradesh, India. Selection. Patients who are already diagnosed with oral cancer of age group 30 to 50 years. Data collection method. A research questionnaire was conducted to Indian nationals of age 30 to 50. The questionnaire is structured questionnaire consisting of questions required to be answered for our survey. The questionnaire has 3 parts: personal details, risk factors, social awareness, and symptoms related. The questionnaire was sent to the respondents through emails and e-forms, which will be easy for us during this pandemic. For a questionnaire to be regarded as acceptable, it must possess 2 qualities: validity and reliability. Data processing and analysis. The data aims to know the extent from which different conditions can obtain from the subjects. Descriptive statistics will be conducted by using the chi-square test frequency and t-tests. The data collected will be analyzed statistically with the help of calculating mean, mode, and median. Questionnaire. The aim of questionnaire is to gather complete and accurate information. We try to focus on writing clearly worded questions using natural and familiar language that respondents fully understand. We are using structured questionnaire type because it has a fixed alternatives like multiple choice, yes or no, or agree or disagree questions, which are mostly used for quantitative studies. Part 1 is personal questions. Personal detail questionnaire is a set of questions that is prepared to gather personal details for respondents. For example, age, which is an important factor to shape our perception of demographic evaluations. Risk factor. When a question has a 2 possible responses, we consider it dichotomous. In this part 2, researchers use this type of question for a clear distinction of qualities, experiences, or respondents' opinion. Part 3, knowledge of awareness and symptoms related questions. Researchers used Likert response scale, which is a rating scale used to assess opinions, attitude, or behaviors of respondents and allow us to easily operate perceptions. We ask an opinion question on a 1 to 5 bipolar scale, so it attempts to measure on an interval level.
Smokeless tobacco, gutka, kheni, pan masala is a huge problem in our country. It's a major cause of oral cancer. This patient has tongue cancer. He had his voice box removed.
We've left everything to God.
This lady here had a part of her tongue and jaw removed.
We had to sell 2 of our bangles.
Tobacco really tears people.
We are seeing about 50 patients a day, and that would add up to over 1,000 a month. 80 to 90% of our oral cancer patients are from chewing tobacco. This is Mukesh's story. Unfortunately, Mukesh could not be saved, and he was only 24. Kheni, pan, gutka, pan masala, they're all...
Thank you.
Okay, who's supposed to critique? Group.
Doctor Group 2.
Okay. What did you say about the presentation of Group 1?
Yeah, doctor, actually presentation is fine. I think they would have improved it a little more. But one thing I would like to ask your group is, so, there are many types of cancer in India, and there is high incidence of the cancer in India is a different type of cancer. I don't know exactly which is it, like lung cancer maybe is the highest incidence in India. But why you people choose only oral cancer? What is the particular reason which made you initiative to do only oral cancer? Can you answer for that? It's my concern actually. I want to know why you people particularly choose only oral cancer instead of other. Like there are many types of cancer with high incidence in India. Can I know from your group? Excuse me, group 1.
Group 1, please answer the question.
Group 1, this is a timed event. You have to answer it within the time limit. Please answer the question.
Yes, doctor.
Yeah, we choose this topic because it's a major concern in youth of our country. We often see people who are highly addicted to tobacco use and alcohol drinking, which leads to oral cancer. And it's been highest in some
Group 1, we can't hear you.
Sorry, there's a disturbance for the network. I'll answer instead of her.
Yeah,
Actually, we choose oral cancer because the youth of India is very much addicted to tobacco and tobacco products such as marijuana and all. So we wanted to do a research on why they are getting addicted, and we want to make and get some awareness to them about how oral cancer is too dangerous for them.
Okay, your concern is that most of the youth in India is addicted to tobacco, smoking and all. So smoking also causes lung cancer, right? Why did you get the interest in oral cancer? Smoking also causes lung cancer, and that too, one more thing is smoking causes not only lung cancer to the person who is smoking, but also to the other person. So why particularly you got interest on this, like oral cancer particularly? There will be a reason, right? Particular reason there will be, I think, your own interest, or maybe you felt that some of your family members would have suffered to made you initiate you to do this research, right? There will be particular reasons like that. What is the particular reason? Can I know if you can answer?
Yes, please. It's not
Yeah.
about choosing this particular oral cancer. It's like I have seen my friends. They do some illegal things which are not allowed in our country.
Okay.
But we wanted to do this because, as I said, not even my friends, many other family members, our own family members who are going to be affected this. So we thought of doing on oral cancer, which is more
Okay.
easier than to explain. Like lung cancer is a bit difficult to explain, so we choose oral cancer for this.
Okay. Okay. Thank you.
We've already crossed the 4-minute limit. Respected faculties, if you have any question for the group.
Doctor, your mic is mute.
Yeah, I'm sorry. Okay. Yes, the question would be, we have to be very particular and specific with your objectives, because you've mentioned in your objectives that you want to investigate with the risk factors and also the addiction to tobacco, and it's actually a different thing. Okay, so basically you really don't laid out specifically what you would like to do with this research, because addiction and risk factors are two different things. And the research design is descriptive, quantitative. Are you sure that this is the appropriate design for this research? Because you're going to review and ask those patients who had oral cancer from 2018 to 2020. Isn't it that this is actually a form of retrospective study, right? And you want to just analyze and evaluate or assess the clinical cases, demographics, profile, risk factors of those people who had oral cancer, right? You just want, if you want to describe it, no, you also want to see if there is what association of the development of such cancer. So it's really quite confusing which is which that you would actually would like to use on this on your methods. Okay, so be very particular with your research design, and be very particular with your objectives, because these two will determine what kind of output that you're going to have. Okay, but anyway, it's actually a good presentation, but you need to just focus on one particular topic that you would touch into. Not everything can be discussed in one study. Okay? Thank you, Doc.
That's why for the critic, that's why they chose a particular cancer. Of course, your research could not look at all the cancers that are existent. However, one of my question I'm sorry. One of my questions would be for the group, what in particular is the prevalence of oral cancer in that particular region is high? As I've mentioned in our previous dialogues or our previous consultations, is there a cultural did you find any cultural nuance or cultural practice that will bring about a higher incidence of your oral cancer? Anyone may answer. And by the way, welcome Dr. Nilo Lopez. Thank you for attending our presentation. Anyone can answer from the group.
Hello, doctor. Hello.
Yes, you're audible.
Go ahead.
Go ahead.
Doctor, as you asked, like if there is a special prevalence, like percentage in a specific region, we mentioned the region which we took was like Uttar Pradesh. So the Kanpur region is especially like there are jokes about that place that even when the child is born, he is given like tobacco, even when the child is born, and it's the like highest consuming state for the tobacco. That's why we choose this region and we choose like oral cancer.
Question: why would they give a tobacco to a child?
No, doctor, like it's a joke. It's just like showing that how much the tobacco is consumed in that state and in that region.
Okay, it's a hyperbole. Okay. I took it literally.
No.
Okay.
It would be more also fitting if you put the video on the first part. So for us to get the attention of our audience and for us to realize the burden of the disease and provide us some more data, not just the video clippings, but the more data, okay, about the burden of the disease, which actually makes your study more significant and relevant. Okay? Thank you, Group 1. Dr. Nilo or Dr. Audrey, would you like to ask more questions?
Dr. Lopez, do you have any question to Group 1? If none, you may proceed with
No
Group
question.
2. If none, you may proceed with Group 2.
First of all, I'd like to welcome Dr. Lopez from all behalf of our students for attending our presentation. Now we'll proceed to Group 2's presentation. Puneet, you may start sharing Group 2's video now.
Hello everyone, today we will discuss our research. So first with the study title, it is to determine the acceptance of COVID-19 vaccine with relation to socioeconomic status, gender and educational qualification among young adults of 21 to 40 years of age in Faridabad. As we all know that many people are ready to accept the vaccination, but at the same time many are not. In India, the indigenous COVID-19 vaccine, Covaxin, is successfully established and many people are also get vaccinated. Around 64% of 316,375 planned beneficiaries were vaccinated on the first 2 days of the immunization drive against COVID-19 in India. So this is our questionnaire. We have one first part which has demographic details and the second is the questionnaire itself. Then statement of problem to determine the acceptance of COVID-19 vaccine with relation to SES, gender and educational qualification among young adults in Faridabad. Specifically, we intentionally choose this topic to find the assessment of COVID-19 vaccine acceptance with regard to gender, with regard to socioeconomic status, and with the educational status of the people. Then hypothesis, we have null hypothesis and alternative hypothesis. Null is like no significant association between the acceptance of the COVID-19 vaccine with relation to socioeconomic status, gender and educational qualification among young adults in Faridabad. And at the same time, the alternative hypothesis is significant association between the acceptance of COVID-19 vaccine with relation to socioeconomic status, gender and educational qualification among young adults. Significance of study is like As COVID-19 is a global pandemic, awareness and acceptability of COVID-19 vaccines are important. As we all know, vaccines are the one which can save the life of person and which can decrease the cases of COVID-19 in the country. So we strongly needed this. The aim is to find the awareness among safety and effectiveness of available vaccine candidates. And this will help the decision makers to formulate the efficient strategies that can help to implement the COVID-19 vaccination program successfully in India. Our sampling population size is 424, but as of now we only got 398 or approximately 400 participants response. First we asked them that they are willing to answer the questionnaire or not. Then you can see we found the results for gender, socioeconomic status, which we linked with their family income per annum, then educational status like no education, school level, graduation and post-graduation level, and at last we got the responses in this manner for each question, like the blue represents the strongly agreement and the purple color represents the strongly disagreement.
Coming to review of literature, we reviewed several articles regarding this acceptability of the COVID-19 vaccine. So after reviewing all those, we found that there is very less acceptance of COVID-19 vaccine among the people. So in one of the research which was done in Congo on the acceptability of this COVID-19 vaccine among the healthcare workers. So they found that there is only 28% of the COVID-19 vaccine is accepted by the healthcare workers. This may be due to a lot of misinformation in the society. So to maintain the benefits of the vaccination program, this hesitancy is very important to take the measures which are needed to implement them successfully. So coming to one more research which is on the determinants of COVID-19 vaccines in USA, they found that there is a significant geographical and demographic disparities in the acceptance of COVID-19 vaccine. And coming to one more article in Bangladesh, which is on the knowledge and attitudes towards this vaccine, they found that only quarter of the people are willing to take the vaccine, and there is higher association with being female in acceptance, and there is higher association with higher socioeconomic status and the education level. So there is a lot of good information and also a misinformation regarding these vaccines. So but there may be potential of getting a negativity in people regarding these vaccines due to these misinformations or wrong informations in the media.
Let's talk about the methodology. Firstly, the research design. The research design here is the analytical cross-sectional study design, which will be held in Faridabad among the young adult group people, which is from age 21 to 40 years old. Now talking about the questionnaire is consisting of two parts. First is the demographic details and the second is the questionnaire itself. For the data gathering procedure, we will be providing these questionnaires in an online medium as the conditions are not feasible right now for physical deliverance. Then we will be asking them to respond to those forms, which will be purely on Google form based. Nextly, if we talk about the instruments or the tools, they are the questionnaires itself. Whenever we talk about research, it should be valid and reliable. So for the validity, we have been testing this research to a study expert who has a expertise in this matters. Secondly, most important, we will be conducting a pilot test before conducting the actual survey. For the reliability, as it is a Likert based questionnaire, we will be using the Cronbach alpha test. Nextly is the statistical tool. Most importantly, after conducting the survey is to analyze the survey. For analyzing, we are using the Anova or the analysis of variance. And the procedure of Anova is that it compares different independent variables to the dependent one, which is the gender, SES, as well as educational status, to the acceptance of COVID-19 vaccines among the respondents. Now we will talk about the formula. This is which you can see here is the formula of the Anova. Now after the formula, we will be talking about a major thing or the most important part, which is the sampling. Sampling consists of the in this research is a cluster based sampling, because we are selecting a particular group of people, which is 21 to 40 years old people in the whole population of Faridabad. This formula here shows the formula which we use to calculate the sample size. After doing all the maths, we concluded that the sample size should be 424 participants or respondents. Lastly are the dummy tables. The dummy tables firstly consist of the profile of respondents, which will be containing the information which we will be gathering from the demographic details after we provided the questionnaire. Next, or the last demographic or the dummy table which we'll be using is the table for the ANOVA. This will show us the acceptance or the significance of the hypothesis, which would lead us to the inference making out from it, and analyzing or interpreting that we should consider the HO or the null hypothesis or the HA, that is the alternate hypothesis.
Now, ethical consideration. All procedures of our study are done according to guideline of institutional research ethics. Participants were informed about procedure, purpose, and participants' consent were taken during data collection.
Okay, let us hear from group 3, the assigned critic.
Yes, doc. Hi, your video was really nice, but I have a few questions to ask. Why did you choose only 21 to 40 years old? Why not more or why not less? You can take from 18 years or more than 40 also, right?
Hello, is I'm audible?
Yeah, you are.
Go ahead.
Actually, we just choose this population because, as we all know, that this age is the newly added age to the society. There we can, they all can take their decisions, and they are the active participants. So it will be just easy for us to take survey from them. And as we all know that this early adulthood is the age of adjustment to new lifestyle. It is a creative age, change in lifestyle, and change in social perception also. So we as a whole group just interested to take this age, so that's why we just choose this.
Times they may not specify the name.
Okay,
Another
can I
question
have?
is, did you do the pilot study?
Am I audible? Hello?
Yes, you are.
Yes,
you are.
go ahead.
Okay. So Kiran, actually we did the pilot study, and in that pilot study we also got some recommendations. Firstly was that in previous one when we made the questionnaire we didn't include the informed consent. So after doing the pilot study we kept the informed consent. Then secondly we had one more point, that many people in our pilot study group, they found it difficult to understand the language like English. So then when we made our final one, we added the native language, which is Hindi. That's what second recommendation from the pilot study or the review which we got. And lastly was that we had kept many things mandatory, like the age, then the contact details and all those things. But many people don't like to disclose those details while doing a survey like this. So then we got a review that we shouldn't keep it mandatory. We should keep because of that we kept that optional. So these are like three recommendations which we got after doing the pilot study. So we corrected those in our research to make it more valid. Thank you.
Okay, for my comment with group 2, I'd like to congratulate everyone for a good job. Although it seems that the sequence, the first part should not include the questionnaire or the statement. No, you have to know the proper sequence. And my only comment is that the review of related literature, I would be more interested if you're going to discuss about the vaccine acceptance in India in general prior to COVID. Since India is known also to be the world's leading manufacturer of vaccines, you have the capacity to have your own vaccines. So I would be more interested if you're going to correlate it with your study with the general perception or attitude of majority of Indians. So maybe you would present the coverage for the adult and the childhood immunization if you have a full good coverage. And now what will happen if we're going to introduce now the COVID vaccine? So you make use of a lot of study in the review of literature that you presented are actually coming from other parts of the world. Why not focus your review of literature in your country alone, right? And your study is in fact a cross-sectional study. When we deal with cross-sectional study, what do you want to look? We want to look on the different aspects of one particular population, and then you correlate it because you want to know what the determinant factors of COVID vaccine acceptance, right? And you want to evaluate that. So basically, your topic will going to evolve on this. So you have to consider using cross-sectional. Anyway, your methodology is clear, and I think this research is feasible.
Thank you, Doctor.
Okay, Dr. Audrey, Dr. Lopez,
I'd
you
like
have
to
something to
commend
say?
also for your video well done and research well done. Who suggested for you to use ANOVA as a statistical test?
Ma'am, actually, Doc Janice, she suggested us that ANOVA would be good for your research after we presented our research to her.
Okay, could you enlighten your classmates on what is ANOVA primarily used for?
So basically, what is ANOVA? Like ANOVA is a statistical tool which is used in the SPSS format. Like we do it in that. In that, what it's going to do is like it's going to compare the independent variables which are not connected among each other to a dependent one. So basically, if we consider here the independent variables like the gender, the SES, then the educational status, we're going to compare that with the acceptance rate of the COVID-19 vaccine after we get the details from the respondents. So ANOVA is nothing. It's just an analysis of the variables, like they compare each other, like they compare the variables from the dependent and the independent ones. So it's basically a comparison based thing.
Okay, ANOVA is short for analysis of variance, and it takes into consideration the different statistics as far as variables are concerned. Did you actually compute? No.
Ma'am, actually we just got we need 424 respondents and we got less like 300 something. So after we get all the respondents, then we are thinking of analyzing the data which we get.
Okay, so you well, this is just a protocol presentation. So actually, even if you get the values, you just input it in the SPSS format, and then it computes it for you, or you hire a statistician if you cannot do it for yourself. Okay, Dr. Lopez, any question? Okay, prepare the third group.
क्या करना हमसे
Hello everyone, this is Apurva Chavan from Group 3 and we will be presenting on the topic of assessment of the mental health status of international medical students during the COVID-19 pandemic. Now we are going to talk about the problems faced by international medical students during COVID-19 pandemic, and basically going to talk about how the online classes are becoming the new normal. We can see that the COVID-19 pandemic has caused a sudden shift towards the exclusive adoption of online teaching from the normal teaching of face-to-face and become a primary source of medical education, which has enabled us to remotely study out of our convenience. Now we can see that students who are studying abroad have been recalled by their home institutions due to the government requirements for the international students. The COVID-19 pandemic has put us in a unique position to evaluate the significance of online teaching platforms in medical educations due to the necessary attributes of COVID-19. Now, we have to ask the question in this research whether the effect of COVID-19 pandemic and lockdown has affected the mental health status of international medical students. While looking at some objectives of this research background, they are the COVID-19 pandemic had a substantial impact on university students, including those in medical schools, with disruption in their routine education, causing significant psychological distress. Undergraduate medical students are especially prone to mental health disorders and hence could be more vulnerable to impact of the pandemic. The objective of this study is to the assessment of mental health status of international medical students during the COVID-19 pandemic. Hypothesis. Now, there could be two kinds of hypothesis. That is, one is the null hypothesis, or another one is the alternate hypothesis. The null hypothesis provides us that there is no significant association. The other, that is the alternate hypothesis, presents us with the idea that there is a significant association between mental health status of international medical students and COVID-19 pandemic. Going towards the significance of this research, that is the mental illness like depression, distress, or other mental illnesses among the medical students, which are compared to the general population and their peers. Secondly, the studies on mental health are needed to the psychological well-being of students undergoing such situation or pandemic, which has seriously affected their ability to learn and function well, given these lead of the negative mechanisms. Now our research uses a cross-sectional design. First, let me tell you what a cross-sectional design is. In medical research, social sciences, and biology, a cross-sectional study, also known as a cross-sectional analysis, is a type of observational study based on a particular population or data. Giving an example of a cross-sectional study which is done on the basis of the cancer patients while taking a particular population and a particular demographic. Now, our study attempts to determine the relationship between the COVID-19 pandemic and lockdown and the mental health status of international medical students. The goal of this design is to get the current thought and feelings in given group of population. This study is performed on medical students, particularly of our JFSM University of all year levels. The data collection method, further part will be presented to you by my friend Kiran Mai.
So, data collection, an electronic form questionnaire is created and has been sent to the participants in the survey. Collected data is evaluated by using Kessler Psychological Distress Scale and GAD-7 anxiety. The researchers administered the survey to 303 students as respondents for distress and 328 respondents for GAD-7 anxiety. In the data processing and analysis, the questionnaire be included in that form are age, gender, name, and questions related on our topic of mental health among medical students. The data are collected among JFSM Med students. The results are encoded and analysis according to the score of the respondent. And we used Kessler scale and GAD-7 anxiety for calculating that encoding and analyzing the score of that respondent. And these are the scores and we used for distress and anxiety. For distress, the interpretation of our results is out of the 303 students, 41.6%, that is 126 of female and 58.1% or 176 of male have been recorded, and 10 to 19 likely to be 30.3% with male and female. 22-24 is likely to have mild disorder with 22.1%, and moderate disorder is with 18.1%, and severe disorder with 29.3%. For anxiety, out of 328 respondents, 53.9% of male and 45.1% of female have been recorded, and minimal anxiety scores 44.2 for both male and female, and mild anxiety is 23.7%. Moderate anxiety is 21.10%, and severe anxiety is 10.9%. And according to this graph, we after calculating all the data, we got that age of 21 years and 22 years have more anxiety issues comparatively
comparatively to other ages, and 25 years age have less distress, according to our studies. Graph for anxiety shows age of 22 years have more anxiety comparatively to other ages, and age of 24 and 25 have less anxiety issues, though the severe anxiety is shown in age 25 years. The questionnaire what we included for the form.
The questions look for
Group 4, you can ask your question.
Okay, the video which you have provided is fine. And my concern about your research is, do you think the response you have now is sufficient as a representative for your research?
Hello, Group 4. We are confident and we are determined that our responses is enough. We determine the sample size for this number of responses by setting up a confidence level of 95% and a margin of error of 5%. With a population size of 1,000, which we determined the sampling size as 278 responses. And we sent two questionnaires as explained in the PowerPoint. We collected 303 responses for variable 1 distress and 328 responses for variable 2, that is anxiety. So these two responses was already above our limits, above our goals.
Okay, thank you.
Okay, the next question is then, how do you think your research design and tool will help you able to achieve the goals of your study? Can you elaborate?
Hello. So I would like to address that our goal was to mainly know if the students were going through stress or anxiety, for which we used the Kessler and the GAD. The Kessler being the scale for stress and GAD is for anxiety. By using this, we got to know that the majority of people are relieved, are not in that much of stress, and a minority, like 13% of people, were in stress. So we were able to achieve our goal through these two scales. Yeah, thank you.
Okay, Dr. Audrey, can I throw my question?
Okay, go ahead.
Okay, congratulations, Group 3. The presentation was quite clear, and we also acknowledge that you were able to show us your dummy table in a manner that we can write there and there the differences among the responses. No, although my concern is you are talking the effects of the COVID on the mental health of the medical students. It's actually quite broad. And you've also mentioned in your introduction about online class. Okay, so do we actually have to focus only on the online class impact or effects of the COVID in general? Because these are actually two different things. So if you're going to be more specific, it would be the impact of online class on students' mental health due to the pandemic, right? Because that's more specific. But if you're going to talk about the effects in general of COVID on the mental health of the students, then one of those would be the online class. Okay, and you have to be very particular with this. Can you please comment on this when you're trying to figure out what would be the main objective of this study? Are we particular with the online class, or are we just giving us, you're just giving us an idea of the overall assessment of the mental health of medical students?
Sir, I think we tried to cover just the online classes by taking only one variable, because if we had done it in general, so we would have to take more variables into consideration. And given our the way of our research, that is cross sectional, we took only stress and anxiety, so we had to go with just one variable. Thank you, sir.
That's why your title of the study would be differ. The title of the study would now be the impact of online class on students' mental health due to COVID or something like that. No, not you go back to your title. Your title is a generalization. What you
Yes,
want
sir.
to, what you want only to determine is what is the impact of
Yes, sir.
online class on the students' mental health.
Okay.
Right?
Yes, sir. We will make the
Okay.
necessary change, sir.
Okay. I
Yes,
think
sir.
that's, we have to be very clear with the title, and that title alone will also give us what is the objective of this study. Because if you're going to give me assessment of mental health status, regardless of whatever causes the stress or anxiety, then I would presume that this is going to be a general assessment,
Sir,
right?
sir, actually, what we try to do is like considering the COVID-19 lockdown, right? So, given as a online classes being one of the attributes, but other than that, like when we were in the university, we used to have group studies and all, so it was easier for us to study. Also there were classes, we were attending classes, so we were more attentive in that manner. So if we take like two or three variables into considerations and our title, so that was what we were trying to say. But as you said, that we should focus on one, so we can just change our title and go for that.
So that would actually make it simplified. The study will be simplified if you're just
And
going to
it's
focus
more
on one
clear.
variable. And it's also
Yes, sir.
more
Yes,
clear.
sir. Yes, sir.
That's because I remember when we were discussing this prior, of course there are a lot of variables that would come into play. Not just online class, um, being in the front lines as a student when you become clerks and interns. Those are things that would affect your mental health. The mere fact that you are in a peak of a pandemic and you are Indians would cause would really affect mental health, as far as even as you, especially for you medical students. So you have to be clear on that. And Dr. Navarro very much improved on your title. See, just a few additional words: impact of online teaching in the mental health, etc., would make an impact. Okay, would make your objectives clearer. Okay, but I commend this group also for a very clear presentation. Dr. Lopez?
No question.
Go ahead with the next group.
Thank you, ma'am.
Thank you, doctors, for your valuable advice for Group 3. Now we'll proceed with Group 4. So that please share screen for Group 4.
Hello everyone, good PM doctors. This is Dubey Shambhavi from Group 4, and today I'm here to give a summarized review of our research topic, that is comparison of the prevalence and risk factors for tuberculosis between urban and rural areas in South India. So let's begin with the introduction. So as we know that, next slide. So as we know that tuberculosis is one of the infectious disease and it poses a serious threat to the worldwide. So basically, we know that according to WHO's Global Disease Burden Report, tuberculosis is reported 7th, and India has high incidence of TB cases annually with an estimated disease prevalence of 256 by 100,000 population. Incidence of 185 by 100,000 population, and deaths of 26 by 100,000 populations. So in order to eradicate TB, India have implemented certain control programs since 1962. So the first one was RNTCP in 1997, that stands for Revised National Tuberculosis Control Program, and the second one is NTEP, that is National Tuberculosis Elimination Program in 2020. So yeah, let's proceed further with the research questions. So as we know that before starting any research work, we need to perform or we need to facilitate research questions. So basically our research question is specifically aims to what is the prevalence of TB in South India, what are the risk factors contributing to increase of TB in South India, what are the risk factors for individuals with and without previous medical condition to acquire TB, the socioeconomic profile, and why is TB highly prevalent in urban than in rural areas of South India. So let's proceed further with the significance of the study. So our study aims to compare prevalence and risk factors associated with TB between urban and rural areas or the population of South India. And the benefit is that it devises a plan or a case controlled study using surveys and contribute to insight into creating highly needed TB program that will educate the community, which are either individualized or targeted to need different population, and as well as aids in treatment and follow-up. And the duration of span which we took was of 5 years, that is from 2015 to 2020. And also the makeup of the incomplete clinical data, that is Institute 1974 in many parts of South India, especially the rural areas, were done on Microsoft Excel. That is, the data was tabulated or all the collected data were used, and also we used a chi-square. Now the possible outcomes or the expected outcome was that this pilot study could serve as a potential blueprint to track the barrier that deter the patient from seeking the treatment, as well as make access and treatment to be delivered directly to the patients. So let's proceed further. So next is our literature review. So we took 5 literature reviews. So to better understand the evidence that have surrounded TB community in South India, so we have conducted a comparative study, as I said earlier, in its prevalence between urban and rural area. So for that, we search a popular databases such as PubMed and Science Direct, and we found 25 articles of which we have relation to our topic in question. So in the next slide, you can see our literature review. So these are the 5.
I will be discussing the general objectives, hypothesis, and limitation of the study. The general objectives includes to compare prevalence and risk factors of TB between urban and rural populations, to compare reasons why TB rate is high in urban areas than in rural, to highlight possible reasons for the increase of TB among individuals. And this is a pilot study, could serve as a potential blueprint. Specific objectives includes the identification of risk factors, geographical locations, and socio-economic status. It is also to identify disparities between the two communities and readdressal of programs. Null hypothesis is no significant difference in prevalence and risk factors of TB in urban and rural areas. And the alternative hypothesis is there is significant difference. The scope and limitations of the study does not include TB in children and individuals undergoing TB therapy, as well as pregnant women. The questionnaires will only be done in English language in the pilot study. The research design includes 3 urban cities, 2 rural, and there is a total of 7,530 participants over a span of 5 years from 2015 to 2020. The inclusion criteria is participants must be between age of 18 to 60, must be both male and non-pregnant females, as well as permanent residents, individuals with and without medical problems, as well as limited to such predisposing factors. Exclusion criteria is as follows. The instruments we use for data collection will be analyzed using Microsoft Excel. The gaps in the study. If treatments exist, why is TB still a problem in India? Probable reasons are difficult access to treatments, other factors that complicates attempts to eradicate TB, poor quality care, as well as limited awareness. So why is the current TB vaccine is not effective against treating TB? This is what it says by Bahadari in 2016 paper. The current TB vaccine elicit immune response, the activation of immune cells is delayed. This is the timeline. These are our dummy table, as well as the questionnaire, such as age, because we are looking for participants between the age of 18 to 60, as well as gender, marital status, education level, occupation, as well as social economic status. Part 2 of the questionnaire. This is our bibliography, as well as the expected outcome. So how our proposal will address the need of the problem statement. This pilot study will broaden the understanding of the existence of barriers that deter patients from seeking treatment. It is also for the device of new programs, such as making access and treatment to be delivered directly to patients' community of homes. It also, how does our proposal, if it is accepted, benefits the community that we have an interest in addressing TB issues? This will not only improve recruitment efforts, but it is also the presumptive of TB cases in their social network, such as a snowball approach for screening and linkage to treatment. It can also help to individualize or target needs of different population can be applied on a larger scale. So why is our research worth pursuing? It does not only benefit the community, but also the government as well as the healthcare worker. It helps to reduce the burden, create population stability and growth, reduce the scrutiny of people seeking treatment, improve the resources as well as public facilities for ease of treatment. It will also help to measure the growth of knowledge about TB as well as to determine or predict the kind of programs that would be effective. What to be expected of our study? We will be expecting 7,530 participants in total over a span of 5 years between the year of 2015 to 2020. This comparative data will be used between the two target population that will be able to show the improvement or decline in the community. Not only that, but also through the geographical location. So these are my co-researchers.
Group 5, you may now ask your question for Group 4.
Okay, so Group 4, I really like your video and the whole presentation, but I have one question. The title of your study is Comparative Study Between Rural and Urban. But in one of your research questions, the question was, why is it more prevalent in urban than rural? I mean, are we considering that is already more prevalent in urban? If it is already proved, then why are we conducting a research which is comparative between those two?
Group 4, you may answer the question.
Hello. Okay, so to answer the question, the literature review that we did on Soham Gupta and Narayanan, both done in 2011, they both concluded that the prevalence of rural area is actually more. And so the reason why we're doing this is that was a research question. Why is it high there in urban than in rural areas? That is what we're trying to find out. Hence why we're comparing the prevalence of urban and rural areas. That is also why literature review is really important in doing research, because it helps you as a guideline of achieving your study goals. Thank you.
Okay, I think that's fair.
So I would like to request the professors, Dr. Audrey.
Okay, you're comparing two different sites. Why were these three sites chosen as your sites of study as far as tuberculosis is concerned? What is the demographics and epidemiology of the two? How were is that province or cities in India chosen?
Or are we comparing the most prevalent rural or urban areas that are actually with high prevalence?
Yes, doctor, we are doing our research with the areas which are really highly prevalent. So we already mentioned in our research, we took 3 urban cities and 3 rural areas. Like in urban cities, we took Bangalore, Chennai, Hyderabad, and also in rural areas, we took Chenapur and Puttur. So, yeah.
Okay. Is it the most prevalent, or those cities the most prevalent as far as
Yes,
tuberculosis?
doctor.
Yes.
Yes, doctor.
Based on
Based on the overcrowding, we have take the socioeconomic profiles based on this HIV condition and other medical related conditions, and also because of the occupation, and as I said, because of the overcrowding, people are more there in urban areas as compared to the rural. So yeah.
Don't you think your study is quite biased? Because we know for the fact that urban areas would definitely have a high prevalent rates of tuberculosis.
Yeah, doctor, basically we are finding here. So
Actually, I disagree with that statement.
as you can see in our research question, point number 5, it states that we wanted to research whether there's really a relationship between the different variability. So we wanted to know, is it possible whether the urban area can have a higher prevalence than the rural area compared to the other research that we have seen in the literature review? Hence, that's why we use the chi-square method, which is supposed to see the different variable, whether is it the chances of getting TB based on the different variables. Is it due to chance, or is it really because of the variables that is affecting it? So I disagree with that statement.
I think it would actually more fitting to say that your study is actually going to give us the tuberculosis situation between rural and urban areas, not basically the prevalence itself, but prevalence is one component. But if you're going to compare, you compare the tuberculosis situation, right?
Yes, that's correct. But
yes, for us not to take, and this is also included in your objectives to determine why there is a high prevalence. It was stated in your objectives.
Yes, it's
That's
true.
why it was asked by your by group 5 because it was stated. So you're giving us now idea that is high prevalent in urban.
Yes, that's true. But still, the questionnaire is on a pilot study. So we are trying to search if it's possible that in the urban and rural areas, if we try to research what are the factors that are affecting in these areas, we can also apply to other areas, because the questionnaire is targeting a large group of people. So that's why we have to do a pilot study first to see if the questionnaire is really relative to our study objectives. So
we are actually more concerned on the factors that actually affecting the high prevalence of tuberculosis.
yes, the
Am I
questionnaire has
correct?
the questionnaire has a few questions based on that.
Factors that actually
Yes,
affecting.
correct.
Okay. And you want to compare the factors between rural and urban areas. Am I correct?
Yes.
Can I see the questionnaire? Can I see the question?
It's in a Word document. We only gave a few summary of it in the presentation because it was limited to only 7 minutes.
Okay. What give me an example of the questions.
Fadhan, your presentation has the questionnaire. The PDF you submitted, does that have the complete one?
Yeah, it has the complete one.
Sure, then Puneet can share it. Puneet, can you please share her questionnaire for once? Kiran, if you have it, you can also do. Kiran, you can also do. You're also a host right now.
Can you go to page 18, the one on part 2, predisposing factors? This is not my research, eh? This is group 5.
Research.
I'm group 4.
What are the questions that you remember offhand?
Okay, the questions are like predisposing factors like age, sex, marital status, what is your education level, what do you know about TB, is it hereditary, how is it transmitted, where can you get the treatment, how do you diagnose your treatment, where do you go, what are the side effects, what are the reasons why you are not going for the treatment. Sometimes they go for the first treatment, but the subsequent treatment they don't go.
So you're looking more
Questions
of
like
the
that.
knowledge and
Knowledge,
attitudes of the people regarding tuberculosis, urban
yeah,
versus rural.
yes, correct. Yeah, the part two disposing factors are all the parts that help to showcase why they are not going for the treatment. Maybe that's why there is a higher prevalence, or maybe it's because of the treatment center is less accessible. Maybe that's why the prevalence factor
So,
in
so you're
the,
saying occupation can be a risk factor in tuberculosis?
yes, correct.
And
This question,
why this specific you because this is a checklist eh? Why specifically this occupation? And how would you know if the patient has TB or not? Are you going to give the questionnaire to those who have TB or to
I
those who don't have TB?
this actually we did one letter whereby we will be distributing it to all the 5 hospitals, 25 hospitals in the 5 cities. So we will
Okay, and
request
then
them to tell us which patients have TB or
okay,
patients who
okay.
are predisposed to TB to help us to do the questionnaire.
Okay, so you're saying you're going to give the questionnaire to those patients who have TB. Is
Yes,
that what you're
correct.
saying?
Yes,
Okay.
correct.
So it is proven tuberculosis. And then you're going to ask them these questions.
Yes.
Okay. Okay. How can you know the risk factors in this questionnaire?
Because this questionnaire is also has been used also previously. That's how we can also use the same questionnaire.
Okay. Can I see more questions?
You can scroll down the.
So basically, you want to gauge the knowledge of the individual regarding TB if they know everything about tuberculosis. Is that what you're saying?
Yeah, if
Because based on this one, I don't understand how can knowing all of this be a risk factor in tuberculosis. This so you're basically asking them that their knowledge about tuberculosis, right? Basically,
yes,
you're asking them about their knowledge. So how would you, from this data, how would you conclude that what are the risk factors that you're expecting? How can you what are the risk factors you're expecting from this one? So you're saying if they know that the symptoms of TB is back pain, if majority of them know that the first symptom of TB is back pain, therefore they're less predisposed to tuberculosis. Is that what you're saying? I don't understand. How can you know the risk factor based on these questionnaires? Ha? Because for example, there's a study published before last 2015, prevalence and risk factor of adult pulmonary tuberculosis in a metropolitan city in South India. What they discovered that the risk factor they discover are undernutrition, slum dwelling, indoor air pollution, and alcohol intake. Those were the risk factor they discovered. Okay, but none of this question you don't even know. Did you ask the living condition in this questionnaire? Living condition, maybe that's the more appropriate thing. Where do they live? What are their living condition? Is it well ventilated? Right? Do you even ask smoking in this questionnaire? Huh?
Yeah, we did ask about
You
smoking.
did?
Yeah,
Can I see?
it's in question number 7 or predisposing factor. What is the cause of TB? Is it hereditary, germ, smoking, related, spiritual?
No. Because it's different when, if knowing is different from doing. Do you understand, class? What if I know that smoking is a risk factor? You should ask them, do you smoke? Do you understand? You're actually asking the person who has TB, do you smoke? Right? And then if you said yes, oh, maybe that's a risk factor for that person. But you're asking the person, do you know that, do you know the risk factor? Do you understand what I'm asking you?
Yeah, I understand.
None of these questions are not known. Under nutrition, you could just ask the weight. You can just compute the BMI. Do you understand? You just can just compute the BMI. Right? Or alcohol intake. Do you even have here alcohol intake? What? I don't understand this questionnaire. It doesn't fulfill your objective. Okay? And also, so you're not going to ask patients who don't have TB. Right? And how would you know that if that quote unquote risk factor is exclusive for those who have TB? What if a person without TB also have the same answer as the person with TB? How would you differentiate a person with TB or without TB? Because you're only giving the questionnaire to a person confirmed with TB. You understand? I don't know. That's all. Thank you.
Okay, let's proceed.
Okay, doctor. Thank you, doctors, for your valuable comments on the previous group. Now we'll begin with group 5. Siddharth, may share the for group 5 now.
Research data is relationship between the obesity and emotional stress eating in young adolescents who are aged between 13 to 19 will be conducted in a city of Delhi, India. So, why we have chosen this topic? There is a fact that is depressive symptoms are associated with obesity. In that, emotional stress eating play a considerable role in gaining weight. So, in this study, we are going to examine the association between the emotional stress and the BMI in a high school in a city of Delhi, India. We will be conducting this research in the young adolescent who are aged between 13 to 19, and we also try to assess if the emotional stress eating is a contributing factor for increasing BMI or not. There is another fact that is the young adolescent or the adolescent period. It is a critical period in which a lifetime habit is acquired. So in this case, if an adolescent is related to the unhealthy lifestyle or unhealthy eating style, it will be a contributing factor for their obesity. So, what can cause the emotional stress in the young adolescent? It could be basically the examination stress or changing of schools, doing multiple activities, or they are trying to get in the competition. So when there is a chronic depression, it will elevate the level of stress hormone, that is cortisol, and it will trigger the craving for fried, salty, or the sweet foods, and it will give them instant pleasure, and that will be the main etiology for causing the obesity. So that's why we are conducting this research, that is the relationship between the obesity and the emotional stress eating in the young adolescent who are aged between 30 to 19 years old.
My name is Syed Sailusen, and for our research, I'll be discussing about the topics significance of the study, obesity and hypothesis, and the conceptual framework. So let's start with the significance of the study. As psychological factors play an important role in the progress of obesity, there are considerable amounts of studies and researches that shows emotional stress can be both the cause and the consequence of obesity with a bidirectional relationship, which basically means that when a person is suffering from emotional stress, that can lead to emotional eating and finally to obesity. On the other hand, when a person is suffering from obesity, that can directly lead to emotional stress. Due to complex etiology of obesity and its high resistance to treatment, it is very important to address factors such as emotional stress, especially to start at young age or specifically in young adolescents. We are conducting this research because it will benefit us to devise a plan for nutritional education, adequate emotional stress management, and detection of individuals vulnerable to stress, which are crucial in young adolescents to reduce high risk of obesity. So, the general objective of our research is to examine the association between emotional stress related eating and BMI in an Indian urban city. And our specific objective is going to be to assess if there is a significant relationship between the emotional stress related eating and obesity in young adolescents. So, our alternative hypothesis is going to be that there is a correlation between emotional stress related eating and obesity in young adolescents. Our null hypothesis is going to be no significant correlation between emotional stress related eating and obesity in young adolescents. So now what you're looking at is just a concept of how the relation between emotional eating and obesity is related. So first we have the predictor, which are the stress symptoms. As we all know, and what Subhajit has mentioned, there are so many factors that contribute to emotional stress in young adolescents. This stress is leading to emotional eating, which in this case is our mediator, and this mediator in excess will lead to increase in weight or BMI. So hypothetically we can assume that the predictor can lead directly to our outcome, which is the stress symptoms can directly cause an overweight in a person, which reflects the part C in our conceptual framework.
I'm Siddharth Kalra and I will proceed with research design. Okay, so we are conducting a cross-sectional study among adolescents residing and studying in the capital of India, which is Delhi. Our study population will be students from age group 13 to 19, and our study area will be a school in Delhi. To target our population, we'll be sending out surveys from grade 8 to grade 12, and hence our sampling would be stratified non-randomized sampling. Okay, let's move on to instruments. We'll be sending out a survey via Google Forms that will collect the participants' age, BMI, gender, and it will be composed of two questionnaires. The first one is Eating and Appraisal Due to Emotions and Stress Questionnaire, EADES. It is created to measure how one uses food to cope up with stress and emotions. The other one is the Perceived Stress Scale, PSS. It is the most widely used psychological instrument for measuring perception of stress. It is a 10-point questionnaire. Data analysis. The data was tabulated, analyzed, and interpreted. The description of variables was performed using percentage for categorical variables and means and standard deviation for continuous variables. Association between variables were evaluated using bivariate and multivariate analysis. The bivariate analysis looks at two paired data sets, studying whether a relationship exists between them. Multivariate analysis uses two or more variables and analyze which, if any, are correlated with a specific outcome. And then linear regression model was used to study bivariate association between stress and BMI, stress and emotional eating, and as well as emotional eating and BMI in both men and women. hypothetical interpretation of results, we are expecting to find that there is a significant relationship between obesity and emotional stress-related eating, and that emotional eating would be identified as a mediator variable between stress and BMI. However, other factors that contribute to weight gain should also be taken into consideration. An integral approach in preventing and managing obesity should include detection of stress, depression, emotional eating, among other obesity risk factors. Nutritional education, adequate emotion management, and detection of individuals vulnerable to depression are crucial in young groups to reduce high-risk factors of obesity.
Now I would like to ask the next group, that is group 6, to ask the critique for the to present the critique for this group 5.
Yes, hello everybody. I'm Mohit from Group 6. So my question is very simple from Group 5, that you have taken the topic that is very like pinpoint, like the puberty age or the adolescence age from 13 to 19th age group of people. But the obesity may be caused by other factors as well, like the hormonal changes at the time of puberty. And that may be caused by other factors as well, not only due to the stress eating. Okay, that's the clear one. And now the thing is, I want to ask how you will differentiate between obesity because of hormonal changes or it is because of stress eating. Because we have seen in our so many lectures of pedia and all adolescents lectures that obesity may be also caused of hormonal changes. So how you would gonna differentiate between stress eating and the hormonal changes obesity?
Okay, so Mohit, that's a
Before you
very good
proceed with the
question.
answer for that, can everybody please turn on their videos while they are asking questions or giving answers? And the group that is who is being deliberated right now, all of them have to open their cameras. Sorry for the disturbance. No, you can continue, Siddharth.
Yes, okay. So of course I get it. There can be a lot of reasons for increase in BMI at this age. And of course, in our limitations also we included that there can be others. But as far as your question is concerned, let's say hormonal changes. That's why we are taking two variables into consideration, not just emotional eating, stress and emotional eating. Let's say if the participant is not stressed, then he will get a low score on PSS. So he is already excluded from the research. If he's not stressed, we'll not consider him. He already scored low on the PSS. So if on the PSS scale, on the stress scale, he's scoring high and he's also high on emotional eating, then then we can see an increase in BMI. Then only it all makes sense. If he's not stressed, of course, there can be many different reasons for BMI increase. See, our conceptual framework included stress symptoms and then mediators, emotional eating. If he's not stressed, then of course that's end of the discussion right there, right then.
Yeah, I got your point, but actually I have discussed this because you haven't mentioned that hormonal changes, and that's a very big part of this
this presentation had only 7 minutes, so we didn't include everything in this video. But
I got your point.
But in the PDF we have limitations, and we have included anything, including genetics also. I get it. A lot of factors can increase BMI.
Was it part of your exclusion criteria?
Yes.
Yes. All right. So that answers the question, Mohit. It's in their exclusion criteria that any participant that would have hormonal or any disease that would cause obesity is excluded from the study.
Yeah, ma'am, I got it, ma'am.
Okay, Doc El Rey, may tanong?
With regards to your, were you also going to determine the factors that affects obesity? That will also be included in your review of related lit?
So I'm sorry, Doctor, I didn't understand. The factors of what?
Yeah, will you also determine the factors effects or the effects of obesity?
No.
Determine.
We are not assessing the prevalence or risk factors of obesity. We're just testing if emotional eating, stress that will cause emotional eating, can these factors lead to increased BMI? So no, we are not discussing risk factors of obesity.
That will also be in your limitation. Okay.
How could you determine if the overeating is related to stress, or that person is just hungry or just eats a lot?
That I think that will be solved by the emotional eating questionnaire that we have. If the person scores high on the emotional eating questionnaire, so I think that proves that the person eats a lot when he's emotional. And if he's also stressed, because which can be proved by PSS, and if all those things are combined together, then I think we can predict that that person is eating because he is stressed or she is stressed.
I agree. Whether you're sad or whether you're happy, there's a tendency to do things that you love, and one of those things would be eating, or just eat for eating sake, etc., etc. It could go both ways. That's why there's a gray area. It's a gray area. What your research is trying to prove.
What is your expected outcome?
We are expecting that it will be related. There will be a relationship between emotional eating and obesity.
Okay, I think it would be appropriate if you're just going to have a systematic review of all the studies conducted with the association of obesity and emotional eating, right?
Yes, yes, we did go through a few researches. There was a research that correlated depression with other factors like obesity, and in that research also they concluded that there is a significant relationship between, and it plays a role of mediator in stress and obesity.
Because if you're going to do a systematic review or meta-analysis, you are actually studying different types of studies that's discussing this topic. So anyway, you're just replicating their study. So what's the difference of this study from the previous study?
Sir, we checked, there has been no study conducting that relates stress and obesity in India, or specifically Delhi. There is no study like that.
Okay.
I think one of the most important difference is Indian students have different eating habits from other students. So that's why they're doing this study, because the population itself is different. That's the most different thing of this study compared to other studies. I'm sure there are studies in Caucasian students and other studies from other races, but what's unique about this study, it's specifically Indian students. And we all know that Indians per se have a different eating habit compared to other races. So I think that's one of the significant thing of this study. Would it also be reflective with Indians compared to other races? Because I think they have the study that the same study was done also in other students. Okay, so am I correct?
Yes, doctor.
Okay.
If there are no questions, shall we proceed, doctors, to the next group?
Go ahead.
Thank you, doctor. I would like to thank doctors again for the valuable recommendations for the last group. Now we'll move on with the group 6 presentation. Siddharth, you may now share your screen for group 6 video. Thank you.
Good morning, doc, and hello everyone. This is Shravan. We are group 6, and our research topic is mental health and depression among the people during COVID-19 lockdown in India. This is a longitudinal study.
Introduction. In January 2020, WHO declared the outbreak of a new coronavirus disease. Due to this, our Prime Minister Narendra Modi declared a lockdown for 21 days, limiting the movement of the entire 1.3 billion population of India. The lockdown was placed when the number of confirmed positive coronavirus cases in India were approximately 500, but it did have a significant and variable psychological impact in each country, including India. The psychological effects of pandemic are best understood in terms of psychiatric and psychological problems. The responses to social isolation and lockdown, the psychological responses to the diagnosis, the public responses to those with symptoms suggestive of COVID-19 infection, as well as the aftermath of the infection. Significance of study. The above study aims at providing high degree information regarding the mental health among the people of India during the pandemic's lockdown phase 25th March to 31st May 2020. This article might provide beneficial to the following people. Firstly, the citizens will be benefited because they will have an idea or knowledge regarding the health problems that COVID brought with it. Students. Secondly, the students might use this article to get an idea about the scenario of the ongoing pandemic in near future. Researchers. The third group of people who might be benefited from this or the researchers, they might use this information for their own journals. Background of the study or literature review. The WHO declared COVID-19 as a public health emergency of international concern on 30th January 2020. COVID-19 pandemic has reached a level of humanitarian crisis with over 6 million confirmed cases and deaths reported globally to date, 31st May 2020. The consequences of COVID-19 impact not only the physical health and well-being but also the mental health, which can have a disastrous effect on the health system. Research design. Retrospective correlational study design. Subjects. In this methodology, we have interviewed different people of different age groups and different parts of India because all group members are from different parts of the country. A range of research strategies can be introduced through a critical examination of the interview and examining the relationship between research questions and methods of collecting and analyzing qualitative data. Data collection method. Qualitative research technique. Qualitative data collection methods play an important role in impact evaluation by providing information useful to understand the processes behind the observed results and access changes in people's perceptions of their well-being. The following questions are the questionnaire we asked to the different age groups. Thank you.
Traditional definitions. COVID-19 pandemic and lockdown has brought about a sense of fear and anxiety around the globe. The phenomenon has led to short-term as well as the long-term psychosocial and mental health implications for children and adolescents. The quality and magnitude of impact on minors is determined by many vulnerability factors like developmental age, educational status, pre-existing mental health condition, being economically underprivileged, or being quarantined due to infection or fear of infection. Data processing and analysis. Longitudinal based study and qualitative approach. We conducted a review and collected articles and advisories on mental health aspects of children and adolescents during the COVID-19 pandemic. We put up the major findings under the thematic areas of impact on young children, school and college-going students, children and adolescents with mental health challenges, economically underprivileged children, impact due to quarantine and separation from parents, and advisories of international organizations. Conclusions. There is a pressing need for planning longitudinal and developmental studies and implementing evidence-based collaborative plan of action to cater to the psychosocial and mental health needs to vulnerable children and adolescents during pandemic as well as post-pandemic. This is a need to ameliorate children and adolescents access to mental health support services geared towards providing measures for developing healthy coping mechanisms during the current crisis. For this innovative child and adolescents mental health policies with direct and digital collaborative network of psychiatrists, psychologists, pediatricians, and community volunteers are deemed necessary. The present study is a frontrunner in exploring levels of anxiety, stress, and depression in the Indian population. The research findings indicates that students and health professionals need special attention because of the higher psychological distress. It is imperative that government, NGOs, and other agencies that are instrumental in distributing and deliberately delivering focus more on people who do not have enough supplies. Lastly, policymakers also need to care for students and healthy professionals as the main stakeholders in the society.
I would like to call next group, that is group 7, to critique the video or the presentation.
Hello, I'm Athara Maker from Group 7. That was a quite pleasant presentation, but I have one question that how do you expect or any positive changes in the target population that you have been done the research with, or what are your expectations through the research?
Hello, Group 7. According to your questions, I'd like to answer. Since right now the situation is really bad, so I don't think any kind of like measurement would help us to improve the situation regarding the mental health of the people. But for the age group of we have considered three age group, that is from the middle childhood, the adolescents, and the older ones. So I can say for the adolescents, that is the middle childhood, they exactly at this age, most of the motor development occurs, and since they are confined into the boundary of their house, I would suggest they need to go out. They need to go out. They need to go out and play with the ones who belong to their age. So because at this age, the social support, the structure, the sense of structure, and the stimulation, they are deprived. They're deprived of the social support and the sense of structure and the stimulation which they are supposed to get from them. And regarding the adolescents, we adolescents are always stressed because firstly we have the exam stress, and then other things as well, because at this age most of the hormonal changes, most of the hormones do take place, and then secondly most of the hormones do take action takes place. So for the adolescents, they need to engage themselves into more kind of activities like exercise and all. They can engage themselves, meditate themselves. And for the older ones, I don't think the older ones are less affected by this pandemic, because most of the at the age of 60, these type of the older people, they need their family with them most of the time. So, and if they are depressed, they are mostly depressed because because most of the time they have lost some of the family members. So in that case, this is my answer. So mostly engage yourself in kind of activities. Yeah. Thank you. I hope I'm able to justify your question.
Yeah, that was a quite elaborative answer. Thank you.
Yeah, thank you.
Professors, respected professors, if you have any questions for the group.
Okay, Group 6, I'm quite concerned with the target population from child to young adults to elderly. Do you think that the study is actually feasible? You're actually going to have the study for the entire age group?
Yes, Doc. Yes, Doc, we did some research. We considered the age from 8 to 13, and then from adolescents, that is from 14 to 21, and then exactly the late adolescents, we haven't considered it because they are mostly we have included them into the adolescents, the whole adolescence thing, and the older ones. And for the middle age, we haven't considered them. So this is what the research is about.
Don't you think it's going to be a very big study to involve all of this age group? Why not focus on just one age group? Are you going to compare the effect or the mental health of each age group? That's why you include in them differently?
Yes, Doc.
Yes, Doc, we did compare. We have here, we did not focus on a single group because in this pandemic, even the younger ones, the child, the who are in their even the adolescents and the older ones are affected as well. So that's why we haven't considered a particular group. That's Doctor.
Yeah, that's right. Is one of your objectives of the research is to compare the responses or
Yes,
to
Doc.
compare the mental health of each age group and see if there's actually differences?
Yes, Doc, there is difference because the older ones, they became more, when we did some research, we did find some difference, but mostly in our research, the younger ones are highly affected because during this age, they're confined within their house. They're not getting the social exposure. They're not getting to attend any kind of offline classes, where mostly they uh, 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 they mostly get to develop their identity, and then they get to develop other skills as well, and they become more clingy to their parents because they're spending more time. And then adolescents, they are mostly experiencing worry and anxiety can be seen among the adolescent. And and the older ones, they're not much affected according from our research, Doctor.
That's why if you're using that argument, why not focus on your adolescent population or the one that they call Gen X that's very much affected with this lockdown. They find issue that they cannot go out, have their social life, etc., etc. Plus, their adaptation skills are quite in question. This is according to some previous studies that Gen X would lack that what they call grit, that at the slight occurrence of any adversity or anything that would change their plans, they crumble. And that has been proven time and again with some socioeconomic researches that has been done. Maybe you could focus on that particular age group using the argument that you have answered. Because as you
Yes,
said,
Doc.
those who are quite older are not that much affected.
Yes, Doc. Yes, Doc, we could have, but like we wanted to show it in a vast manner, so that's why
You
I'm
wanted to
Doctor.
cover a lot of ground. But again, your
Yeah.
research, remember to focus. Yeah,
Okay,
come to
Doctor.
think of it, for example, you could look at people who are introvert, extrovert. Introvert, there's not much difference because they would really prefer to stay at home.
Yes,
But the
Doctor.
extrovert, they feel like they're so locked up. They have, it's like the end of the world that they cannot go out. Things like that. Okay?
Yeah, yeah.
Focus.
Yes, Doctor.
You
Surely.
are trying to
Okay,
cover
Doctor.
so much ground. Focus on one age group or one particular population. Or one other thing that you could do to adjust your research, you could do your lots of population, but you could focus on a certain demographic. For example, doctors in particular or an occupation in particular. You could get samples from young ones, older ones, etc. So you could do it that way also. Okay?
Okay, Doctor. Yeah. Yeah. Thank you, Doctor.
What's the youngest population you intend to include?
Doctor.
What's the youngest?
Doctor, Doctor, we have included here the middle childhood from to adolescent, that is from 6 to 21
No,
age.
the youngest. So you want to do, did you segmentalize it like the childhood, then adolescent, and then young adult? Did you do that? Did you group them or
No,
in general?
no,
All of them?
Doctor. The childhood, we have considered the middle childhood, that is from 6 to 12, and the adolescence is from 10 to 21, and the very old is above 60, Doctor.
All of them will answer the same questionnaire.
Yes, Doctor.
How would the 6-year-old answer the questionnaire?
Doctor, we have sorry, Doctor, but we have included the 8 years specially, but usually our research is from 6 to 12, the middle childhood we have considered. Yeah, but we did interview the 6 years old.
You did you
The 8 years, sorry.
So this is an interview also, not just a survey.
No, doctor. Yeah.
So you interview the 6 years old. And what are
No, doctor. The
no?
What
8 years,
are your
doctor.
expected results for the 6-year-old?
Pardon, doctor. Doctor, can you just repeat it once again?
For the 6 years old, what are your expected answers?
For the 6 years old, doctor, that is the preschool. I don't think they would. I think especially they are mostly home oriented, since home play a very important role at this age. I don't think they will be much affected, because mostly their most issue is mostly related to the house upbringing, their family, how the parents deal with them, because at this age mostly the tantrums, the anger and all issue can be seen. So I don't think would be affected by this pandemic, but the middle childhood, they are mostly affected, doctor.
Middle childhood. Okay.
Yeah.
So hence, that's the point of Dr. Navarro and Dr. Audrey regarding getting a specific group of population to concentrate, because
Okay, doctor.
the first thing you said was in adults there's no much effect. Then the problem with the younger ones, how would you assess a mental health of an 8-year-old child?
Doctor, I will assess by for the for the middle age children. They usually become more how to say that. They become more aggressive. Like they become more stubborn regarding what they need, and usually at this age, like they when they don't get the things what they want, they become more stubborn regarding those things. They would start behaving in a uh, uh, very notorious way, maybe. Doctor, I'm so sorry, doctor.
Okay, because I'm having a hard time imagining how you would get the mental health of, let's say, a 6-year-old up to even a 10-year-old child. How would
Yes,
you
doctor.
how would you assess the mental health? I'm sure there is something. I'm sure the child psychiatrist should know whether how to assess a child with mental issues. But your plan is just to do a survey, or uh, if you're saying that it will also involve an interview, wow, that would be a very massive undertaking if you plan to interview parents of 6 to even 10-year-old all over India. Do you understand how massive that is?
Yes,
So
doctor.
I don't think that's feasible.
Yes, I agree.
Okay. So I don't know if you want, just concentrate on what maybe Dr. Audrey would define what Gen X means. Maybe that would be like ages 18 to 25? I don't know.
Yun lang naisip ko, Gen X, laging pinag-iinitan.
And I think if you're going to consider the children, no, it's basically more of the behavioral of the child. And if it's going to be behavioral, it's more of observation. So definitely you're going to involve the parents or the primary caregiver.
And you will
So the
see.
questionnaire would be addressed to the mothers, not directly to these children, unless a child psychiatrist will get into the story and observe the child, right?
And you will
Yes,
see the
doctor.
changes that their idea of play is now through video call. And that is what pandemic brought us. And when we adapt
Yes,
to the
doctor.
times, they will still find ways to play. But with their technology, they are playing through video call, through the internet also. Okay?
Yes,
So,
doctor.
And
points
we
to play.
realize, yeah, And we realized that the children are actually the most resilient among the age group during this pandemic.
They will
Okay.
just
Doc,
play and play. Buti pa sila. All right,
Doc,
next group. Very good. Yes, yes, yes. Who's that?
I want to just put one more point, Doc, because if you would say like we will take the particular age group, but in our title we have just included the particular timing, like the first lockdown, the 21 days of first lockdown in India. So at that time nobody was have any kind of the idea like what is gonna be, because that was the first time that happened in our everybody's life. So I think if you will take the particular age group like middle adolescents or the old one, then it would be not, I think, according to me, it would be not justified, because I think that was the first time and that was the first lockdown for everybody. So almost everybody was affected at that time. Like in children, like sir said just now, like behavior, we can notice the behavioral changes and the other kind of their tantrums, because they are not able to go out of the house to play with their friends and all. They are not allowed to go in the street to play. So that may be, I think that is also somewhere affect our study if we will take the particular age group, because that was for the initial days of lockdown particularly.
Yes, agree that it's a novel and every reaction would be I'm sorry, and every reaction would be new. But every particular age group would more or less have a nuanced reaction to the lockdown. What we are telling you is just to focus on one particular age group so that you could analyze it more in depth and have a more um, conclusive conclusion, more definitive conclusion. That's what we are trying to say. But I agree with what you're saying that the lockdown is new, everyone will have an experience, everything is novel because the virus is just 2 years old. So there, see, that's the good thing about a new virus. There's a lot of opportunity for research. So no more smoking, sleep, and coffee. All right. So we're seeing that you're thinking of other research topics. Oh, now we're full of COVID. Anyway, next group. Are we done with this one? No one, no other ideas from the floor. If not, we could go to the next group.
Yeah, Doc, thank
Sure,
you.
doctor. So for next group, we have group number 7. Siddharth, can you please share the screen for group number 7 now?
Okay, so we'll start now. Hello everyone, this is Priyanka Manwar from group 7 and our PMCH research topic is drinking motives in Indian medical student from University of Perpetual Health System Delta. Okay, so aim of this study is to investigate the differences and similarities in drinking motives in Indian medical students studying in UPHSD. So what are the factors and what are the motives Indian medical student has and that provoke them for drinking? All these differences and similarities among the students we are going to investigate in this research. The introduction part. The alcohol consumption is one of the main risk factor of premature death and as well as most of the avoidable disease. So young people are at a greater risk of this alcohol related harm than adults. So as brain keeps developing during the mid 20s and drinking alcohol at this age like teen age, they can obviously greatly increase the risk of damage to the developing brain. So it can also lead to alcohol related harms, which includes a range of negativity consequences such as violence, injuries, academic failures, as well as some unintended pregnancies and sexually transmitted disease. Next. So about the research or the data from previous research says that about 46%, that is 12.4 million of young adults, they engage at least once in the drinking that exceeded the recommended daily limits, and 14.5%, which is 3.9 million, had an average consumption that exceeded the recommended weekly limit. So the medical study reports that a sipping 1 or 2 drinks per day isn't that bad. A student's decision to drink alcohol can be influenced by, it can be because of the early introduction to alcohol or exposure to adults like binge drinking or alcohol dependence. It can be because of the access to alcohol from parents or other relationship problems, friends who drink heavily, access to cheap alcohol, parental relationship and attitude to alcohol, then money to spend, conflicts or bullying conditions, or long period of unsupervised time. All these factors can greatly influence young adults to drink the alcohol. Procedure, the one which we used in this research is, so this study basically measures the drinking motives among Indian medical students, and these are basically in the range of 18 to 25 years from the University of Perpetual Health System, Janata. So this research was conducted through online. As we know that it's a lockdown everywhere, so we conducted it through online using a Google form. There was a questionnaire with 20 items in that, and the link was generated and it was passed to each and every student, which falls in a range between 18 to 25 years. And this link was shared via social media. So to avoid missing out this data, the form were kept mandatory for the participants to answer all the questions. So if they missed out one question, they will get notified and they will unable to submit the response until all the questions were fully answered. So we got almost like 200 responses for this questionnaire, and it was quite easy for both the researcher as well as the participant, as it was conducted through online.
So beginning with, the statistical method were used to analyze if the outcome measures and appropriate and well recognized are explained so that they can be understood or perceived early. Second, cross-sectional or descriptive type of observational study is used. Third, WHO QOL brief questionnaires are the tools used in this study. Fourth, the statistical analysis was done by using SPSS version 20. This experiment can also be used to test new methods of measurement and analysis, and for that methods are available to accurately assess the new measure.
So in order to find the drinking motive in Indian students from the University of Perpetual Health System, Delta, we conducted our research and we did it through the online form. We used a set of questions. We made the questions to and made sure to cover all the possible reasons which could trigger the extent of the drinking in a student. Our main motive of the research was to find the reason behind students drinking. We used the SPSS to analyze our data to determine the difference in the motive of drinking in students. We used the alcohol, the alcohol was taken as the dependent variable, whereas the motives were taken as the independent variable. And the gender and age was the controlled in the analysis. So next. Next are the results. So according to the National Survey of on Drug Use and Health, 58% of students between the age of 18 to 22 use alcohol. So this we can see in the pie chart, which is just beside in the picture. There, as in the options, we can see that 27% of the whole 27% are the almost always, like the drinking motive is almost always, whereas 13% is some of the time, 10% of it is most of the time, and 10% of it is half of the time. So this in total makes up to the 58% of students who consume alcohol. And the alcohol consumption, considering mostly under the legal age of drinking. And since we got 100 responses from the Indian medical students studying in the University of Perpetual to know the scale of the motive to take the alcohol. So next slide, please. As a result of this statistical analysis, we found that the student usually consume alcohol for fun or to forget worries, to get high or to enjoy friends and celebrate the special events. And
what we do in this research is that we examine drinking motives in a sample of college students, that is, among the Indian medical students in our university. And the prospective design of this study with excellent follow-up rates, inclusion of all 4 drinking motives in analytic model, and use of distinct validated consequence domain as outcome variable represent the strength of this study. And the research design we use in this study was cross-sectional type of observational study.
So I'll be. This is the last group that has to do presentation today. For from group 8, as the leader of group 8, I'll be critiquing the group 7. Now, group 7, the thing I want to ask you guys is that your whole research revolves around alcohol, right? The alcohol use and consumption. And as far as I know, if somebody gives me a questionnaire and asks me questions like this, I won't say yes. So how sure you are that the data you will be collecting from the students is gonna have some resemblance or is gonna be true in first place?
Yeah, actually, that's the limitation of our research. Actually, we when we forwarded this questionnaire, obviously there aren't like 100% responses we got, because there are many students who even drinks, but obviously they don't want to disclose it. But as we are conducting the research, so we should also keep in mind, we should also keep these things in mind. But obviously the responses we got, on the basis of that, we will proceed to our further studies.
So your questionnaire is basically anonymous, right? I think if it is anonymous, it will be really helpful for you guys.
Yeah.
Okay, thank you. Doctors?
So what is the main objective of this study?
Doctor, the main objective of this study is to like investigate what are the actual similarities and differences among the students. Like, is all the students do it for fun or for being more social, or some to forget worry? So what are the exact factors that influences these students, like medical students who is studying in perpetual, that provokes them to study? So this is like why we choose this topic, because it's not the participants of this topic are not some unknown people. It's basically very personal, because those includes our friends, the people with whom we study, whom we see daily. So it's basically between them. So if we investigate all these factors, then it can help us to tell them it can help us to basically try to solve their problem and avoid these things.
So it's basically the patterns of alcohol consumption and drinking motives among medical students, right?
Yes, doctor.
And what are actually your expected outcome?
Actually, in the questionnaire, we included the factors that usually like provokes young adults to consume alcohol. So when we we already have got 200 responses. So in a final research thing, we are gonna use SPSS method and all to calculate everything and consider the factors. So basically, our outcome will be like, what are the exact factors? That's the same thing. What are the exact factors that provoke student, and then we'll use it for like further studies.
And what do you think is actually the impact of such pattern of alcohol consumption in the medical school or for a medical student?
Actually, doctor, the outcome, the impact is basically we can educate them regarding this, and we can even tell them like what are the health effects, and we can make them aware of these health issues that comes with the binge drinking, and also it can also affect their academic performance with such type of drinking habits. So we can make them aware of these factors by conducting this research.
Okay. So this actually would focus also on some interventions, effective interventions to prevent and probably reduce the drinking problem among medical students, if there's any, right?
Yes, doctor.
And that will also needs to be included also in your significance of study. And also try, if you're going to ask yourself or answer the questionnaire by yourself, truthfully, do you think you're going to have a truthful data based on the questionnaires?
Uh, Doctor, if we consider this factor, then most of the research questionnaire, no one answers it perfectly, right? Like it's always there is something, this thing, right? Like,
Yes. And why do you think people were going to withhold such information? Or why do you think some people will not be as truthful as they are in answering such question,
mm,
especially alcohol drinking?
like most of the people are okay with telling these things, like yeah, they do drink and all the stuff, but yeah, there are few who do not really want to disclose it. But even if we got 50% responses, not 100 but even the half, then we can still consider the points, right?
Mm-hmm.
Yeah, so
So
on the
you
basis
have
of
to
that.
include, yes, you have to include in your related literature about how alcohol drinkers actually behave. Some alcohol drinkers will deny that they actually
Yeah.
have an alcohol, yeah, they have an alcohol drinking problem, and that's actually denial. So what that criteria alone can give you idea already, right? So you need to
Yes.
consider also what are the effective tools on how to see if the person is actually having alcohol drinking problems,
Yes, doctor. Okay.
right? And maybe you would also see what are the factors that a person actually, or factors that can affect alcohol consumption. And would you interested to know about such factors on this study?
Yeah, doctor. We will consider that too.
Okay. So Dr. Lopez, still here? Yes, sir.
Yes. Yes, yes, yes. Um, can I see your questionnaire? Is it a preset questionnaire? Are you the one who made it, or did you
No,
get it
doctor.
from?
Doctor, we got it from you. Like you just forwarded one questionnaire and you asked us to use the same.
Yeah. Can I see?
Sure, doctor.
So
Yes.
Kiran, can you please put up the questionnaire for group 7? Kiran?
Oh, 1 minute,
Oh,
1 minute.
sure.
Hello. Yeah, that's it. So, Dr. Navarro, if you can see the questionnaire, I don't think some students would even lie with these types of questionnaire. Do you understand? I don't think that these types of questionnaire.
Is incriminating.
Yes,
Mhm.
that's the point. That's the because this study is very simple.
Mhm.
They just want to know why medical student drink. Okay, and if you can see the questionnaire, there's nothing there that you need to lie about. So
Okay.
I don't think that there will be any problem in uh, in any result or any biases in terms of the results. Okay, so that's the only. It's a very simple research. Yeah.
Okay. So what could also be your limitation when it comes to this study?
What, doctor?
What would be included in your limitation?
Doctor, the limitation of our study, we choose the age group from like 18 to 25 years, but there are still some students studying in perpetual who are like younger than 18 years old, and they are studying, they must be in AB Psych or first year of MD. And even there are some students who are more than 25 years and they are in third year and internship. So obviously, though, we cannot take the responses of those students. So that's the limitations of our study.
Okay.
Dr. Audrey, can we move
Thank you.
towards the end of the event for today?
I think thank you, Dr. Lopez. I think Dr. Audrey could not join us anymore. And
Okay.
Yeah, I'm here. Sorry,
Dr.
I had technical difficulty. So,
Okay.
isn't it, as I've mentioned in one of our lectures in data collection, bias, and confounders, the mere fact that you're choosing medical students as a respondent already gives bias, right? Why? Why do you think?
Doctor,
Because
actually,
it all,
normally, okay. Sorry, doctor.
again, so, sorry for interrupting. Yes, you're answering.
Doctor, actually, when we choose any topic for research, we always choose one particular area. It's like sometimes a local people, and also it's basically this research is focusing more on our like students who are studying in our own college, because that is also important factor to consider, right? Like what are the exact factors that our own student, the one who is studying with us. So that's why.
They're drinking. So it's a certain bias is not sometimes not unavoidable, but there are ways to reduce bias. So keep that in mind. Okay.
Yes, doctor.
The other points already raised by Dr. Lopez and Dr. Navarro. Okay.
Yes, doctor. Yeah. And it's not like being biased, it's basically being more specific.
Okay.
Yeah. Thank you, doctor.
All right. The host will please wrap this up for this session. We'll continue next week.
Sure, doctor. Sure,
Congratulations
doctor.
again.
Okay.
For this.
So basically, yeah, sorry,
Okay.
doctor. So basically, for today, we are wrapping up the event with the 7 presentations. For the first thing I would like to say is thanks to all our professors, our coordinator, Dr. Audrey, Dr. Navarro, and Dr. Lopez also for your valuable time and listening to all the groups so efficiently and giving them valuable advices. That really means a lot for all of us. I'd like to thank you from behalf of all the groups and all the students that attended the meeting today. Dr. Audrey, as a coordinator, if you have any ending remarks before wrapping this up, we'll be very thankful.
Okay. Nothing more. See you next Friday
Okay, doctor.
for the
Okay,
rest of
doctor.
the group. Okay.
Okay.